the mountain city of Riobamba, Ecuador. Puerto Escondido, a small town on the Pacific coast of Mexico. In Uganda, the lakeside capital city of Kampala. Exotic locations whose scenic vistas mask a common problem. Lack of acceptable medical facilities, limited access to resources, a pool of doctors far too small, a patient population far too big. The Global Health Initiative has worked hard for years to improve the quality of healthcare around the globe. They have sent over 450 medical students to places like these, 36 countries, like Belize and others in Central and South America, Africa, India, and Asia.
The benefits of such a trip are obvious. Besides the beauty and excitement of coming down here, you really do get a broader and wider perspective about healthcare practices throughout the world and about healthcare inequality throughout the world. And I think that no other amount of training that's solely based in the United States can provide you.
One of the most beneficial aspects of it is definitely just being in the culture with the people who are practicing medicine.
In some parts of the world, doctors have to make do without what we would consider the most basic medical tools.
I've had multiple med students and nurses come up and ask me, can I have a glove? Or can I use a little bit of your Purell? Things that we just take so for granted in the States. You know, we always have it, and they just go without it.
It's a problem the GHI wanted to help relieve. Several years ago, they formed a critical partnership with Project Cure that provided supplies to students to take with them to developing countries.
Northwestern came up with a list of supplies that they believe that the clinics and the hospitals here in Ecuador could use. They assembled a bag for us. I believe it has more than $2,000 worth of medications and supplies.
If one suitcase full of medicine can help a whole town, how far could, say, a whole shipping container go? In the spring of 2014, the GHI, Northwestern Memorial Foundation, and Project Cure arranged for just that, sending nearly $1 million in medical supplies to the Dominican Republic inside a shipping container. While these donations are sure to help close the gap on patient treatment on the island, there are continuing crises that supplies alone will not solve. Although the Dominican Republic shoulders up to 80% of the burden of HIV/AIDS in the Caribbean, there is no formal education program for the doctors who treat this disease. The GHI response was to help send Northwestern specialists in infectious disease to provide their own training course to area doctors.
So we started off talking about the science behind HIV, so the virology, the transmission, the infectivity, and then we progressed really to the clinical aspects of HIV, tailoring towards the Dominican population and towards the primary care provider population. And also women's health as related to HIV, so prevention of vertical transmission and other women's issues.
For the past several years, the predominant mission in global health has been to raise the quality of primary care. While there is still much to do in this aspect of healthcare, there is a growing focus on improving the types of specialized care these patients can receive. Orthopedics, gynecology, urology, pediatrics, and oncology programs are becoming target areas for doctors, and with a GHI fund to help meet the needs of these developing countries.
And one of the obvious needs is the appropriate, efficient, safe trauma care.
Michael Self, a student under the mentorship of Dr. David Stulberg, went to Nepal to study the effect of an orthopedic nail, a device used to help treat fractures that was specially designed to be used in areas without advanced medical facilities.
And the way the sign nail is different is that it has that guiding arm on the outside that allows you to place the screws in the bottom of it without using x-rays. I hope that, especially after this experience, that global health is going to be something that's a lasting part of my career.
These kinds of mentorships are another area the GHI finds ways to promote global health. Partnering mentors with students such as Joan Tankau, a Northwestern student from Cameroon. She worked with Dr. Jalila Goba, a Northwestern resident from Ethiopia, and with whom she shared a passion for global health and a desire to bring her medical training back to Africa.
Dr. Goba is really a mentor and a role model to me because of how much she's dedicated to her country of Ethiopia. And to see her do it is so inspiring.
In 2014, with support from the GHI, Joan was able to travel to Ethiopia as part of a program evaluating the OB/GYN care available in that country, and to help research a new residency training program, fulfilling Joan's wish of returning to Africa to use her medical knowledge to enhance the quality of life. The programs you've seen so far are only a few pieces of a complex puzzle. In addition to its clinical work around the world, the GHI is focusing on research as well, discovering new ways to manage a growing number of global health problems. Improving global health is a gargantuan task, but awareness and support is growing, and the stable of research and educational programs the GHI Fund and the Center for Global Health facilitate keeps expanding every year. With the help of its donors, supporters, and partners, the GHI Fund remains the national leader among top medical schools in providing global health rotations, helping to train the next generation of physicians while transforming the lives of patients around the world.